I think it's always a good idea to ask your oncologist or surgeon, for that matter, whether your case might be appropriate for a clinical trial. Whether surgical candidate, meaning somebody who's able to have surgery, or whether the cancer is too extensive for surgery. There are clinical trials going on, and we really want to promote research for this type of cancer so that we can make progress and move beyond where we are today. Most of the clinical trials currently ongoing are for people with advanced or stage 4 bile duct cancer, meaning cholangiocarcinoma that has spread to other parts of the body, lymph nodes, lung, bone, etc. Every time there's a decision point or a branch in the road, we think that's a good time to reevaluate. Is there a good new option to consider here? The most common time for people to try clinical trials is after the first line of chemo, meaning after especially for stage 4 advanced disease, we'll start with pretty standard chemotherapy, which is tried and true and has a very strong track record for success, but doesn't work forever in most people. When that chemotherapy starts to show signs that it's not working, either the cancer looks like it might be growing a little, or the tumor markers are going up a little, or people are having side effects from the chemotherapy that tell them or their doctor that may not stick with this for too long, that's when, as the oncologist, I think it's time to start especially considering what are the clinical trial options. So clinical trials are a combination of some things which are experimental, like a novel drug that's not yet FDA approved, or special tests that are only done for the research, as well as some things that we would do anyway. Standard CAT scans or blood tests are if they're part of standard therapy, they're considered standard of care and billed to insurance. So when somebody enrolls on a clinical trial, some things are billed to insurance if we would be doing them anyway as part of standard chemo, like the regular blood tests and the CAT scans. And then some things are paid for by the research itself, generally the novel medication that is new and we don't know for sure whether it will be FDA approved, and any special tests that wouldn't normally be done. Most insurances, if they cover medical care at the institution where you're seeing a doctor about a clinical trial, they will also cover the standard parts of being in a trial at that institution through your insurance plan. The research part should be paid for by the trial. Now, if your insurance doesn't cover medical care at the facility where you're interested in a clinical trial, that's a challenge, because the standard parts of the treatment need to be covered either through insurance or by payments out of pocket, which can be prohibitively expensive. So most of the time, clinical trials are for people who have advanced or metastatic cancer after they've tried the first-line treatment. We are all trying to find new, better drugs to include earlier in the process, however. So there are some clinical trials now open that are looking at adding novel drugs during first-line treatment, so adding to our sort of our tried and true first-line chemotherapy. We're hoping that maybe if we add a targeted therapy plus chemo, that people with certain targets might have a better response or longer response or prolonged duration of response. And then there are multiple trials looking at people after surgery to see if adding chemo after surgery can help reduce the risk of recurrence. The clinical trials are very complicated, almost living creatures, because there's such a combination of scientific inquiry as well as safety considerations for investigational therapies, which we don't know for sure will help and have risk. So we have to follow a protocol. Clinical trials are run around an approved protocol that is generally approved not only by every single institution running the trial, but also by the Food and Drug Administration. And so we follow that protocol strictly, and the criteria for entry to a trial can sometimes be challenging for people with bile duct cancers or cholangiocarcinoma because of the nature of the disease itself. So the tumors that are blocking the bile duct may make it very difficult for the liver function test to be in a healthy or normal range to allow entry into the trial. And that's not because anybody wants to deprive a patient of the chance to be on the trial, but it's because drugs depend on normal liver function to be metabolized. And in a drug that's metabolized by the liver, or if there's a risk of infection because of blockage in the liver, it's not safe to try an experimental agent in somebody who has an active blockage, as much as we wish we had the chance to.